Thanks for joining me today. We're going to kind of switch gears and talk a little bit more about some of the philosophy, the theory, the modalities behind naturopathic medicine, and some of the reasons why I fell in love with this field. And I'm actually going to close our little pictures here just so that there we go. Perfect. We're going to talk about the unique philosophy of naturopathic medicine, some of the core principles, treatment modalities, and how it combines centuries old healing practices with modern medical science. So, at the end of this session, I hope you'll have a better understanding of what it is like to be a naturopathic physician and what naturopathic medicine is and how it benefits our patients. So, we're going to just dive right on in. I can't see the chat anymore, so after we're done, we'll have time for questions. So feel free, you write your questions in the chat for me. Then I also provided my email for you all, so feel free to jot that down. But I'm Dr. Petshow. I get a lot of veterinary jokes, but I am a licensed naturopathic doctor. I treat humans, not animals. I graduated from NUNM, the National University of Natural Medicine, in 2018, and I completed a residency there for 2 years. I then went off into private practice for a few years and founded Empower You Health and Wellness, which was my private clinical practice where I was able to combine my passion for naturopathic medicine with patient care. I also now am an assistant professor at NUNM. Like Dr. Baltazar, I kind of got called back to teach due to my love and passion for docere, one of our naturopathic principles we'll talk about. And now I'm also holding the role of associate dean of basic sciences or biomedical sciences, where I really help support the first year and second year curriculum, helping you pass your NPLEX 1 exam or your biomedical sciences exam. I got my bachelor's degree from Portland State University here in Portland, Oregon. I also, outside of my kind of clinical world, I'm a high school track and field coach. I've been a track coach since 2012. In fact, I have a track meet later on today, so I'm gearing up to go out and coach the pole vault, which was my personal event in college. I also am a certified personal trainer. I have a pup child named Ella. She's somewhere around here. And in my spare time, I love reading a good book and drinking some good coffee. So, what exactly is naturopathic medicine? Well, it's a healthcare approach that blends the wisdom of traditional natural therapies with the advances of modern science. And this combination allows us as naturopathic doctors to treat a wide range of health issues, from acute conditions like the flu to chronic diseases like high blood pressure and even preventative illnesses. Naturopathic doctors get to work as primary care providers or as specialists, and we offer personalized care for people of all ages. I think my youngest patient in my practice was 2 weeks old, and my oldest right now was 97. So, all ages and stages of life. So, naturopathic medicine is built on the belief that the body has an innate ability to heal itself. So, as naturopathic doctors, we focus on whole patient wellness or holistic medicine. We, as Dr. Baltazar said, not only address just symptoms of disease, but also try to find that underlying cause. The goal is hopefully to provide comprehensive care, and we use naturopathic treatments or natural treatments, preventative medicine, and patient education to do so. We really work with the body's natural processes to help restore health and prevent future illness. So, with that, we're now going to dive into the 6 principles of naturopathic medicine. And Dr. Baltazar showed them on the slide and kind of did a great summary. We're going to delve into those individually and look at how they might apply to patient care and how you might see us weave them through our clinical practice. The principles aren't just something that we talk about once in a theory class. It's truly how we shape our day to day decisions as providers. And so we'll look at each one of these principles in detail. Here's the 6 principles on the screen. Our first is the healing power of nature. That helps to reflect the belief that the body has an inherent ability to heal itself If you get a paper cut on your finger, your body's natural mechanisms of acute inflammation will kick in. They'll start to form your clotting cascade to create a platelet plug. They'll then lie down a nice fibrin mesh to help stop the bleeding and help starting to heal the tissue. And ultimately, a few days later, you won't even notice that you had a cut on your finger. That's really the idea behind the healing power of nature is how can we harness the body's own self-healing mechanisms and make them work better to help prevent and treat disease. As naturopathic doctors, we work really hard to identify and remove any barriers that interfere with this self healing process. We try to intervene when necessary, but we try to not stand in the body's way. Identifying and treating the cause really emphasizes looking beyond symptoms to uncover the root cause of illness or disease. For example, if someone has chronic fatigue, they just can't get out of bed, we would explore factors like nutrition, nutritional deficiencies, stress, or even underlying infections, rather than just treating the fatigue itself. First, do no harm is a principle that's within all forms of medicine, we all know, but it's particularly relevant for naturopathic doctors as we really try to prioritize treatments using that triangle, that pyramid that Dr. Baltazar showed you, the therapeutic order. And that helps us choose treatments that have minimal risk of side effects and avoid suppressing a symptom unnecessarily. So let's look at some beautiful nature and talk about the healing power of nature. This idea is really rooted in the concept that the body is a self healing organism. Our job as naturopathic doctors is to create the optimal conditions for healing. This could involve removing a toxin, improving diet, focusing on nutritional interventions, or even addressing other lifestyle factors that can hinder the body's natural healing abilities. It's important to note that we don't force the body to heal, we facilitate and support its natural move towards homeostasis. For example, if we had a patient that comes in with a cold, we just kind of are leaving cold and flu season, we may recommend things like rest, hydration, even some herbal remedies to support immune function. We wouldn't just treat the symptom of cough or runny nose, but encourage the body's natural processes to recover in a safe and gentle way. Looking at our second principle, identify and treat the cause, we really focus on finding that root cause of illness, not just masking our symptoms. We try to avoid the common practice of just symptom suppression unless if it's really truly needed, which sometimes it's necessary. For example, if someone's experiencing a digestive issue, bloating, stomach discomfort, we're not just going to treat the stomach pain, we're going to look at the whole system, considering factors like dietary intake, stress, gut flora imbalances, and even emotional health, because all these factors influence health and disease. So this is my favorite part is really getting to be a medical detective, connecting the dots between a variety of factors, right? Looking at the whole person to try to find this root cause. And we utilize our physical exams, our medical intake, even labs and imaging studies to really try to get to the underlying cause of disease and then help treat and support our patient using our awesome modalities, which we'll look at. The third principle is first, do no harm. Just kind of funny. It could be the first principle, I guess, but I listed it third today. But this is a fundamental aspect of all medical practices. It's particularly emphasized in naturopathic medicine as we focus on using therapies that have the least potential for harm while still being effective. For instance, when prescribing an herb or a supplement, we consider their safety and potential interactions with other treatments like other herbs, supplements, or even pharmaceuticals. And this principle also guides our approach for symptom management, where we avoid suppressing symptoms that might be helpful for healing. Doctor as teacher is probably one that's the most near and dear to all of our faculty's heart. Docere would be kind of the Latin way of saying this. And this is a really important aspect of naturopathic medicine because patient education is key for helping our patients take autonomy and control over their own health. So, as naturopathic doctors, I have time with my clinical visits where I can spend 30 to 45 to even maybe an hour with my patients to educate them about health conditions, treatment options, and lifestyle changes that can improve their well being. And the goal is really to empower patients to take charge of their own health, making an informed decision, and also helping adopt a healthier habit that will benefit long term health. We're not really just doctors in this instance, we're more partners in the healing journey or even a coach. And so I oftentimes feel like I'm coaching my track athletes, so I'm coaching my patients through some of these health journeys or health decisions. The fifth principle is treating the whole person. We really don't just view illness in isolation. We see it as a combination of factors: physical, emotional, social, spiritual, etc. For example, if a patient has chronic pain, we're not just going to focus on the physical symptom of pain. We'll focus on that too, but we're also going to look about at how their mental health, their dietary, their lifestyle factors are contributing to this condition. And by looking at all aspects of a person, the holistic picture, we can help patients achieve more comprehensive and long-lasting results. And lastly, preventare or prevention is a key naturopathic principle. Prevention is not just about avoiding disease, but it's really about being proactive in your steps to maintain health. We assess risk factors, we look at family history, we look at environmental influences, environmental health, and really focus on helping our patients avoid potential health problems before they even arise. This may include recommending lifestyle changes, dietary adjustments, or stress management techniques. And sometimes a preventive health visit can look like I have a patient coming in to talk about health optimization. And those can be really fun where we look into their diet and we do some diet diaries and nutritional analyses and we create as a personal trainer, I'll often create a fitness plan for a patient, and so there's a lot of flexibility, and there's with that time piece, we really can truly educate patients on their body. So, those are our six principles and how they might be applied in a patient scenario. But Dr. Baltazar also mentioned all the different treatment modalities or the tools that are in your healthcare tool bag as a naturopathic doctor. So, I want to look and speak to some of those treatment tools or modalities that we get to learn as naturopathic physicians, starting with clinical nutrition. As naturopathic doctors, we really recognize the power of food in helping us maintain health and preventing disease. We can offer personalized dietary recommendations based off of patients' unique symptoms, conditions, or overall health. For example, a patient coming into my practice, I do a lot of heart health with my patients. They might come in with high blood pressure, and they may be advised by me to follow a diet called the DASH diet or a Mediterranean diet, which are specific for heart health and for blood pressure lowering effects. We also might talk specifically about nutrients like lowering sodium and increasing potassium, which have also been studied to help reduce blood pressure. And so proper nutrition is really fundamental, part of those kind of key foundations of health to support the body's natural healing processes. And you get to learn about how to not only recognize nutritional deficiencies, but how to apply dietary interventions to your patients in clinical practice. Botanical or herbal medicine is so much fun. You get to truly learn how to use plants as medicine, and they've been used for thousands of years already to heal the body. They're a central part of naturopathic care, and naturopathic doctors may recommend herbal remedies in a variety of forms: teas, tinctures, capsules, even topicals. For example, cramp bark, literally its name, common name, can help alleviate menstrual cramps, while berberine, which comes from Oregon grape, is used to help manage diabetes and high cholesterol. So we can learn how to harness this ancient medicine that's been used for years and years and years and use it in an evidence informed way in clinical practice to help support our patients' health goals. Energetic medicine is such a large category and another important modality. This form of treatment uses diluted natural substances, things like herbs and foods and minerals, to stimulate healing, especially in conditions that might not have responded well to a conventional therapeutic approach. So, chamomile, for instance, which is an herb that you can drink as a tea, it's nice and relaxing and calming, a carminative herb, nervine herb. It could be used in an energetic medicine form for a child that's experiencing colic, or which offers both comfort and therapeutic support. So we learn how to harness these other modalities in energetic medicine. Oh, there we go. Orthomolecular supplementation is just a fancy word for essentially using a nutrient as a supplement instead of the whole food or the whole plant as a part of food. So, this involves using naturally occurring substances like vitamins, minerals, amino acids. And by supplementing the body with these nutrients, we can help address deficiencies, support a variety of bodily functions. For example, with vitamin D supplementation. In the Pacific Northwest, we sometimes don't get a lot of sun over the winter months. If you're from Oregon or Washington, you know what I'm talking about. And so, vitamin D supplementation might be indicated if a patient's deficient to help with mood support and even bone protection, while magnesium might be considered for things like constipation. So, we can utilize these targeted nutrients using evidence to really choose when they're the most safe and effective modality for our patients. Physical medicine, Dr. Baltazar spoke to this a little bit already, but physical medicine encompasses our therapies aimed at improving structural integrity, function, and movement of the body. This could be chiropractic like adjustments, massage therapy, physical therapy. For example, a patient with a rotator cuff injury. I've definitely had one. Being a pole vaulter, my arm's gotten yanked behind my head more than I'd like to admit. May benefit, I can say can benefit from targeted physical therapy regimen to improve strength and improve mobility. And that's something that we can support a patient with a referral to a physical therapist and as well as support them in office with some of our physical medicine techniques to help improve recovery quicker. We do have some more higher therapeutic options, things like injections and IV therapy. This is a way to deliver vitamins, minerals, other natural substances directly into the bloodstream or directly into the body. And it could be used to correct a deficiency or even treat a more severe condition. For instance, the patient who does have chronic fatigue may receive an IV infusion of B12 or an injection of B12 to boost those energy levels, especially if they're B12 deficient. And so you're going to learn through this program how to give injections and how to perform IV therapy, as well as how to draw blood, all the typical doctor stuff. But that can be another way to have more targeted therapeutics at a higher intensity, right? That's going to be a higher intensity treatment than taking a medicine, taking a supplement orally, or eating a food that's high in those B vitamins. So you can kind of see how we're starting to inch into that pyramid, that therapeutic order. Speaking of more high force interventions, pharmaceuticals, although naturopathic doctors emphasize our natural therapies, we're also trained in pharmaceutical prescriptions. And in cases where natural medicines maybe are not enough, not as effective, or where a pharmaceutical medication might be indicated instead, we prescribe medications to manage diseases and or alleviate symptoms. For example, I might prescribe lisinopril, a medication to lower blood pressure for high blood pressure, hypertension. If we're not seeing any movement with lifestyle changes or with natural remedies, or I might do them in tandem. And in fact, I'm oftentimes utilizing multiple of these tools at once to help support my patient's health and healing. Even if you work or decide to practice in a state where you're not prescribing pharmaceutical medications as a part of your license, you're still going to have patients come into your practice on medications. And you'll need to know how to manage and co manage those safely when you're recommending different diets, different nutrients, or different supplements. So we learn pharmaceuticals from that kind of management stage to learn how to prescribe as well as learn how to safely co manage our patients that are on these medications. Another higher, I guess, force therapeutic intervention is minor surgery, although it's really fun. Minor surgery is another part of our ND toolkit. These are non invasive procedures, they don't require general anesthesia. This could be removing a toenail, repairing a laceration. And in these cases, we use local anesthesia to ensure patient comfort while addressing the underlying issue. I mentioned I was a medical scribe at a local emergency room as a part-time job during medical school. Wouldn't necessarily recommend the working piece during med school, but that's a conversation for another day. But during that time, I got close with a few of the ER doctors, and so I did a preceptorship there. And then in my residency, I was able to do an external rotation in that ER. And in that, I was able to work with those emergency medicine providers and also their mid-level providers, physician's assistants, and nurse practitioners, and performing a lot of these minor surgery procedures. So draining abscesses, suturing lacerations, kind of your basic, typical, quick emergency or urgent care minor surgery procedures. And it was a lot of fun. So it's something that we can, maybe not for the patient, but afterwards they felt better. But it is another part of our scope as naturopathic doctors, and it really allows us to work in places like rural medicine or rural healthcare settings, or even potentially places like an urgent care where we could provide some of those supportive treatments to patients and apply our philosophy and principles where they might not get that in a typical kind of short visit that they would have in an urgent care setting or scenario. I already mentioned health education, docere, doctor as teacher, but lifestyle changes, health education are really crucial to long term health. And naturopathic doctors, we have the capacity to counsel our patients on exercise, stress reduction, sleep hygiene, and a whole host of other lifestyle modifications that can help prevent and treat disease. And education is really key to empower patients and ensure their ongoing health and also ensure that they understand the conditions that they're diagnosed with and the management plan. I can't tell you how many times the patients come into my practice or come into the clinic, has a diagnosis or is on a medicine and doesn't really know what that medicine is treating or doing in their body or what that diagnosis really truly means. So, performing and having taken the time to have that health education conversation really helps patients to take ownership and autonomy of their health journey and gain some power back, which in healthcare can be challenging sometimes to feel like you have power over your body. All of these different tools in our tool bag, it's like, how do you know which one to choose? And that's where the therapeutic order has really come into play. It's a concept in naturopathic medicine that really kind of gives us a guiding hierarchy. It helps us guide our treatment choices. And our goal is to start with the least invasive, most supportive approach and escalating up as necessary, up this therapeutic order. The order starts, and we'll see here in a moment kind of a different image, but it starts with removing obstacles to health. Things like environmental toxins, poor dietary practices, and it moves up then to stimulating the body's self healing mechanisms, really speaking to our naturopathic principles. Only when those steps have been addressed do we try to move on to more invasive treatments like pharmaceuticals or supplementation if necessary. And in reality, we're often imploring multiple approaches at one time to provide optimal health for our patients. So we start again with those removing, addressing, kind of establishing the foundations for optimal health, removing any obstacles from health or healing. We then focus on stimulating our self healing mechanisms, encouraging our own body's physiology to work in the way that it should, and stimulating the healing power of nature. We then are focusing on supporting and restoring weakened systems. This is looking at organ systems and organ systems approach and saying, how can I support the heart or how can I support the digestive tract if I'm having a condition that looks like it's affecting that area? We can correct structural integrity by addressing physical alignment, applying that physical medicine component, that physical touch healing component that's so important for helping the body work properly and control pain. We then can look at kind of two different ways to control symptoms, looking at either natural symptom control using a natural substance to palliate symptoms. This could be using deglycerized licorice. It's a chewable wafer that kind of tastes a little bit like candy that you can chew that coats the mucosa of your esophagus and your stomach and can help ease a sore throat or maybe even some acid reflux. So that would be a natural symptom control agent. We're not addressing why the acid reflux is there, but we are providing some palliation. Or synthetic symptom relief using a medication, a pharmaceutical to palliate. So Pepcid would be an over-the-counter medication that could be used to soothe and coat kind of in those conditions. Or Tums, right? And then lastly, high force interventions. These are really our suppressions of pathology. These are our referrals to our specialists, making sure the patient sees an endocrinologist if they have an endocrinology or an endocrine system disorder, that they see a cardiologist to talk about how they can manage maybe a heart murmur. Is surgery necessary? So we work in tandem integratively with our specialty providers to help support kind of these pathways, these strategies. And I wanted to get through this because I saw there were so many chat questions going through the chat. So I wanted to leave ample time for questions that you may have. So whether it's about a specific principle, a treatment modality, a general aspect of naturopathic medicine, I would love to hear your questions to ask. I won't be able to divulge, patient information, but I can definitely speak to how this could be applied or how I've seen it used in clinical practice. So I'm going to stop my share so I can see all your lovely faces again, and then we can open it up to questions, to chat.
I can start with one that was in the chat while you were speaking.
Yeah,
And this could talk about, the different modalities that you're working with too. What sort of preceptorship or clinical hours outside of what's embedded in the curriculum will be required?
great. So I think I'll probably lean into Dr. Baltazar for the specific number of hours because they've varied over the years. I was on an older curriculum track, right, when I graduated, but I can speak to the fact that you will be required to complete outside preceptor hours out of your typical rotations that you do as a part of NUNM. And it's a great opportunity to get to work with both naturopathic doctors and other allied health professionals to see the type of flavor of clinical practice you might want to practice and also help apply naturopathic medicine in other fields. So, for instance, I did some of my preceptoring in the emergency room working with MDs, and there's one DO that worked there at that time, some PAs, and an NP. I worked specifically with one medical doctor, one MD, during those hours, and I was able to round and see patients under their license as a part of my preceptorship. And so I got really well versed in seeing emergencies and especially heart emergencies because we are a cardiothoracic center. That's part of why I teach in the cardiology block here at NUNM. I also was able to do a medical mission during my time. So I went to Nicaragua and worked with an MD that was practicing actually in Nicaragua and was able to see patients over the summer with a variety of health conditions. Again, using my preceptor hours, seeing patients, providing medical care in really a rural, underserved clinic. We were in rural Nicaragua, kind of outside of Leon, if anyone knows Nicaragua cities. And then I worked with a lot of different NDs, some who I ended up applying to residencies with, who I was considering working with afterwards, who wanted me to work there for a job. So it was a great kind of networking job opportunity. And then some other MDs and DOs also in specific kind of primary care integrative health fields. So I really varied my preceptor hours. I was very intentional about where I placed them. And I looked for places that I could consider working at afterwards or areas that I kind of wanted to infiltrate as a naturopathic doc. Like, wouldn't it be great if we had an ND in the ER? Let's see what that would look like. So that was really what I chose to use my hours for. I'll turn it to Dr. Baltazar to talk about maybe the number of hour requirement, because I don't have that number at the top of my brain. Sorry to put you on the spot.
No, it's okay. I just couldn't find the unmute button. In our current curriculum, it's 156 hours that you'll have to complete in your preceptorship experiences. So those hours are ones that you would have to find physicians outside of NUNM to observe.
Yeah. And I can say they go fast. Like I thought, oh, 156 hours, that's so many. But once you start working with a doctor, if you have kind of a regular shift every week of 4 to 8 hours or whatever, you utilize that time really quickly. So I found myself, I ended up doing just extra hours that didn't count for my curricular requirements just because I enjoyed working with those medical providers.
Okay, other question in the chat is, are you currently still running your practice and teaching?
No, not this time. My practice when I started full time at NUNM, I scaled back my practice. I still do have about 10 patients that I see as a part of my private practice. So really, really small, the people I couldn't let go of. But it's very, very small at this time. Although it is something that I plan to kind of relaunch and move back into in the future. But we just went through a big curricular launch here at NUNM, and so I've been teaching a lot this year and helping structure our biomedical science curriculum. So I couldn't do both things, but I was up until 2024. Actually, is when I kind of scaled back to just teaching full time. Yeah, awesome. Good question. I do wear lots of hats, though, still.